All right. Well, thank you so much for joining us, everyone, today. My name is Katie Baker. I am the State Director of Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through events like this one. I want to thank our healthcare champions, Congresswoman McClellan and Senator Hashmi, for joining us today, as well as all of our speakers, and in particular, our partnering organizations who joined us in co-hosting this event. So that's SEIU, I see a few SEIU folks here today, as well as the Committee to Protect Healthcare, which is an advocacy organization of doctors, and we have a couple of their members today who are going to speak to their experiences. We've done a lot of Medicaid events over the last 6 months, and will continue to do so as we are now facing the reality of these looming cuts with the president's signature last week on the big, terrible bill. But today specifically, we wanted to home in a little bit more on the impact that these cuts are going to have on our hospitals, and especially our rural hospitals and our rural health care. We've got a lot of great speakers, so I just wanted to name a couple things. Number one, I think it was last week, KFF, which is formerly the Kaiser Family Foundation, had an analysis showing that Virginia was going to see more loss in Medicaid spending in its rural areas than any other state, with the exception of Kentucky and North Carolina. So states that expanded Medicaid are particularly hard hit, as well as states with big rural populations. And then secondly, and for folks who saw the media advisory, I added to it this morning when I bumped, someone sent me an article from out of Nebraska last week. We already see a rural hospital closing there, citing concern about these Medicaid cuts and how they're going to impact them. And this is a question that we're going to see rural healthcare facilities seeing all across the country, as we know that they're operating on very slim margins and serving a lot of Medicaid patients. So with no further ado, I'm just so honored to be joined again by Congresswoman McClellan, who has really been at the forefront of this fight for us, trying to protect Medicaid from those cuts. Congresswoman.
Thank you. Thank you, Katie, and thank you to SEIU, to Protect Our Care, the Committee to Protect Healthcare, for having me here today and to have this very important press conference. I am Congresswoman Jennifer McClellan, and I represent the 4th Congressional District, which is parts of both Central and Southside Virginia, and includes many rural communities that are going to be particularly hit hard by these Medicaid cuts. You all may remember that back in May, I stood alongside my Democratic colleagues on the Energy and Commerce Committee for a 26-hour hearing fighting to protect Medicaid funding. We shared our constituent stories. We pointed to the data to show just how many people are going to face the devastating loss of their health insurance under the big, ugly bill. Unfortunately, the stories and the data didn't matter to my Republican colleagues because they were on a mission. Donald Trump and the congressional Republicans cut nearly $1 trillion from Medicaid, not to invest back in the system, but to pay for permanent massive tax handouts for billionaires like Jeff Bezos and Elon Musk. And rural America is set to be leveled by these Medicaid cuts, including here in Virginia. The one big ugly bill, or the one big backstabbing bill, or the one big billionaire bonus, whatever you want to call it, is now law. And it will hit our Commonwealth's hospital systems, costing $2 billion each year, and lead it to the projected loss of 13,000 healthcare jobs here in Virginia. Rural Virginia alone is set to lose a devastating $6.8 billion in Medicaid spending over a 10-year period, the 3rd highest in the nation. Now we're talking about people that I represent. And the data shows that one of the hospitals in Virginia that is likely to close, one of about a half a dozen, includes the Southern Virginia Regional Medical Center in Emporia, a town that is still reeling from the loss of 2 major employers in less than a year. Now they're at risk of losing their hospital And at least 5 additional rural hospitals are at risk of closing here, turning the clock way back on all of the work that we did in the last few years to improve access to health care. Now, I like being back here in the Senate because it was here where I helped expand Medicaid in Virginia. I was in the room where it happened. And one of the reasons that several Republicans lawmakers got on board was that they knew how expanding Medicaid would help our rural hospitals. In fact, hospitals across Virginia strongly supported Medicaid expansion so much that they even offered to help pay for it for the state share because they knew how meaningful expansion would be for our healthcare system. The new law, the Big Ugly Bill, will now restrict hospitals' ability to fund Medicaid and get reimbursed for the services they provide to Medicaid patients. And while some Republicans point to the Rural Health Care Fund as a fix, health policy experts note that the $50 billion fund is not even a third of the $155 billion in Medicaid cuts rural areas will see as a result of the Big Ugly Bill. Before Medicaid expansion, uninsured people still got sick. They would just go to the doctor. They would not go to the doctor for their regular health care exams and treatment. Instead, they would wait and show up in the emergency room in both rural hospitals and in urban hospitals, where their conditions had escalated to the point where it was much more expensive to treat if they could be treated at all. ERs can't turn anyone away, regardless of their insurance status, so they got care. And who paid for that cost? The rest of us. Everyone else's insurance premiums went up because of uncompensated care. Because of uncompensated care, hospitals took another hit. So we all lose when 17 million Americans, including over 300,000 Virginians, will lose their health insurance as a result of the Big Ugly Bill, and especially when those hospitals closed. And speaking of private insurance, we're going to see a lot of people who shop for their health insurance on the exchange lose their coverage too, because congressional Republicans let the enhanced premium tax credits expire at the end of this year. So a 60-year-old couple in Virginia that makes $82,000 would see their annual premium for a benchmark plan increase from just under $7,000 to nearly $19,000. Folks cannot afford those types of spikes. They're going to drop their insurance. So we're going to see millions of Americans go uninsured, and healthcare costs for everybody go up. But I want to make sure all Virginians, including the advocates here today, hear directly from me. I'm not giving up. I will keep fighting to right this wrong. I will continue to lift up the stories of my constituents and people across Virginia who are fighting to keep their health insurance. I will fight for our rural hospitals. I will fight for the communities that rely on them. I will fight for our free clinics that are also at risk, because there is no way that the Virginia state government can be asked to fix this problem, in addition to all the other costs that are being shifted to the state, in addition to Virginia residents who are losing their jobs thanks to federal employee cuts. This is a federal problem that needs to be solved at the federal level, because if we leave it to the state, Virginia is going to have to decide whether they raise taxes or cut essential services even further. So I'm going to keep shouting from the rooftops that Medicaid is health care, that health care is important, and that we're going to keep fighting until every American has coverage, and we're going to keep fighting until Congress and the President reverse this dangerous course. Thank you.
Thank you so much, Congresswoman, for your leadership and your tireless advocacy, literally tireless. I could not stay up 26 hours anymore. Not since college. Just really out there fighting for your constituents, including those in rural areas, against this bill, now law. You're absolutely right. The Congresswoman's absolutely right. This is a federal problem that could only be fixed by the federal government. But that said, we need to have champions at the state level And I've just been so disappointed in some of the news coverage lately in which our governor and our lieutenant governor have really not stood up and advocated for the people they represent who are going to lose their health care. I saw the governor making a comment that nobody who needs it is going to lose their benefits. Like, that's an outright lie. Fortunately, I'm glad that we here are calling that out. And the lieutenant governor had been silent for months, and then just over the weekend said, oh, this bill does so many great things. So, like, really hard pressed to know what those great things are when so many people, including those in rural areas and our rural hospitals, are going to be losing health care and potentially shutting down. But fortunately, we're so lucky to have leaders like Congresswoman McClellan and then the state leader, Senator Hashmi, who has been working with Protect Our Care and SEIU and all our health care advocates for months to try to sound the alarm at the state level. And Senator, just thank you for everything you've done for Medicaid and for being a champion, and just so honored to introduce you today. Senator.
Well, thank you so much, Katie, and thank you to all of our advocacy organizations, our partner organizations who are here. Thank you to all of our experts and our speakers who will be sharing their perspectives this morning as well. I am State Senator Ghazala Hashmi, and I represent the City of Richmond and Chesterfield County, and I'm also chair of the Senate Education and Health Committee. And as we have been doing now for the past several months, we're here again today to continue sounding the alarm about the threats to our hospitals and to our entire healthcare system. These are threats that are generated by, and I think we keep coming up with our own names. I have my own name. It's generated by the unwieldy, un-American, ugly bill that was signed into law by Donald Trump just last week. As we all know, our most vulnerable communities and our rural hospitals will be the first to bear the brunt of this disastrous bill. And I'm here today because I share everyone's distress that rural Virginians will lose access to health care as a result of this law. This bill is the biggest cut to health care in our lifetime, and it will result in millions of people across the country losing their insurance. And state budgets alone cannot make up that kind of devastating loss. So let's be clear, these cuts are not being made in order to reduce the deficit. And in fact, the deficit is actually projected to increase by $3 trillion. These cuts to our hospitals and to our healthcare services are being made in order to fund a massive tax giveaway to billionaires. Elon Musk and Jeff Bezos do not need our taxpayer support. This is simply welfare for the wealthy. The nearly $1 trillion in cuts to Medicaid will be felt all across the country and all across our Commonwealth. But rural areas in particular will be hit hard and immediately. Many of our rural hospitals are already operating on slim margins, and when people are kicked off their health care, they're going to start showing up in our emergency rooms. Virginia hospitals and Virginia taxpayers are going to absorb the cost of uncompensated care. This is not rocket science. And additionally, these costs will likely be unsustainable for many of these hospitals, including the 6 that have already been designated as particularly at risk based on financial data that includes a disproportionate number of Medicaid patients that they serve. The real shame of the matter is that most of these hospitals are in districts that are represented by congressional Republicans who actually voted for these cuts, voted for these harms to their own constituents. States that have expanded Medicaid stand to lose the most, as we know. We will be seeing an increase in uncompensated care as people lose their insurance, in addition to the new restrictions that are now placed on the provider tax. KFF, as we know, formerly the Kaiser Family Foundation, put out a new analysis showing that rural areas in Virginia stand to lose more than any other state, with the exception of North Carolina and Kentucky. Virginia is looking at a loss of $6.8 billion in Medicaid spending in our rural areas over the next 10 years. Even further concerning is the fact that because of the decreases in the provider tax, Virginia hospitals are expected to lose $22.5 billion in Medicaid-directed payments between 2028 and 2038. And additionally, Virginia will lose $48 billion in Medicaid funding, including both state and federal dollars. And as these rural hospitals close, these closures impact everyone, not just individuals who are on Medicaid. For our rural communities, the presence of nearby hospitals with an emergency room can be the difference between life and death. And additionally, the healthcare jobs that help sustain our rural communities will also face the brunt of these impacts. And a recent article in Cardinal News highlights the forecast of Ballot CEO, who indicates that these cuts will trigger major job losses in a region in which the healthcare sector is a critical economic anchor for so many families. And I just want to briefly expand our discussion beyond our rural hospitals. Let's be clear, this federal legislation impacts all of Virginia's hospitals. Our entire healthcare system is facing severe challenges. The newly created Rural Stabilization Fund is not a comprehensive solution to the systemic funding challenges that now face us. Urban, suburban, and underserved hospitals will also face severe impacts and are equally at risk under these current federal proposals. Many of our urban hospitals operate with narrow or negative margins. They too serve large Medicaid and uninsured populations, and they are an essential safety net as providers within their communities. And our entire hospital system works to subsidize rural and community hospitals. Health systems with multiple hospitals, including rural hospitals, cross-subsidize these facilities in order to keep them open. The financial harm to urban anchor hospitals jeopardizes their ability to support the rural affiliate hospitals and maintain specialty care, trauma, and advanced services within their system's footprint. So hospitals, doctors, and patients have sounded the alarm. Congresswoman McClellan and Democrats in Congress and in the Virginia General Assembly have also sounded the alarm. I've shared this podium with Congresswoman McClellan many times, talking about Medicaid, and now, sadly, these cuts are going to become reality. We can take some specific actions to try to mitigate the damage. And first and foremost, we must engage in outreach to ensure that the people who are eligible for Medicaid complete their paperwork in order to stay on rolls. But this is just one small step forward. We know we have a crisis on hand. And just now, our governor has been touting his work to reduce red tape for permitting for industry. But he and our lieutenant governor are both busy praising a law that creates more burdensome red tape for moms and dads who are just trying to keep their family's health care intact. By contrast, Democrats in the General Assembly stand for health care, and we will never stop fighting for the health care for people all across the Commonwealth. Thank you.
Thank you so much, Senator. Just so glad to have you as the chair of our Senate Education and Health Committee. And next, I want to hand it over to a doctor who can speak specifically to his experiences, Dr. Larry Clark.
Thank you. And I have a script, but I'm going to depart from it a little bit to try and embellish something that the senator just spoke about, also to kind of talk a little bit about the relationship of Medicaid and cuts in Medicaid and Medicare, and the very thing that our previous two speakers spoke about. First of all, the facts. Virginia, 22% of the population is covered by Medicaid. That's about 1.5, 1.6 adults and children. There is a provider assessment tax that has agreeably been accepted by Virginia's hospitals, facilities, and by paying into this tax, it's about 6% tax, there has been a stable funding which is matched ninefold by Medicare. So this tax helps provide the 10% of the balance with a matching 90% federal contribution to Medicaid. When you start, I'll just give you a little insight here. In addition to my 34 years as an internist in Mount Vernon, which obviously is a DC suburb and doesn't qualify as rural, but I was a Medicare medical director for this state for about a decade as part of a region. So you see this very delicate balance. This particular insult to the Medicaid program will not just hurt in terms of Medicaid, in terms of people being uninsured and coming to the hospitals. It is also going to substantially alter that balance and is going to create even more of a financial burden than we are talking about. I think that I'm here to try and help reverse some of the misdirection that the senator already referenced in the media. I think there's a great attempt to say nothing's going to happen. Well, the reality is that in terms of these cuts, the cuts are going to hurt, obviously, the most seriously impaired individuals, the disabled. We're going to hear about children. But the other problem is going to be, how do the hospitals make up the deficit? Are they going to cut the services? Are they going to cut? The first things that usually get cut are the critical care units in the emergency room. Are we going to not just have some hospital close in our more rural areas? Are we going to have impaired hospitals going along? I think that's a major problem. There's another aspect to this which I think are troubling in terms of misperceptions or misdirections. One of them is something I also I participate in a voluntary clinic that serves a couple of homeless shelters in Alexandria. And last night, and I emphasize last night, we were helping somebody sign up for Medicaid. Now, I emphasize night or evening because it's not just for our convenience. Over 50%, maybe 60% of the people in the shelters are not there by day because they are working. So this concept that, we're going to move people who are collecting on the public dole into the workforce is not true. I see that every week that I take my shift there. And so we have a problem and a misperception in terms of getting folks from, that, they're going to come out, they're going to satisfy these work requirements, and their lives are going to be immediately changed and they don't need the health care. Instead, you're actually making it harder for people who need to get skills to stay healthy, to take care of their families. The percentage that is not out working is taking care of sick people, disabled themselves, taking care of their kids, or going to school to get skills to compete in the workforce. So that is a complete public misperception that's being promulgated. The other misperception that's being promulgated is these folks are, as I said, are going to move into the workforce. There's going to be jobs for them, and they're immediately going to be offered benefits. The other misperception is going to be that the people that are unemployed from hospitals I think it's Governor Beshear from Kentucky was very persuasive in something that he said. Most of the facilities in the rural areas are the second largest employer group in the community. So, first of all, think about being a small business owner in one of those communities. You got problems. Then number two, you're getting displaced from that job, and yet the community itself is shrinking in its employer capacity. So essentially, we're being set up in a lose-lose situation, but being told it is not going to make a difference. So anyway, I think that I want to make sure I hit all the talking points, but this is really, not only is this a situation as critical as our previous two speakers spoke about, but we are getting purposive misinformation from the other side, and we need to be aware of that. Thank you.
Thank you so much, Dr. Clark, for sharing that perspective and your expertise. And next, I am honored to have another partner of Protect Our Care, a longtime partner, Victor McKenzie, who leads SARA of Virginia, which does substance use disorder advocacy. Victor.
Thank you so much, Katie. I always enjoy partnering with you as we ring the alarm for just this really critical issue. Thank you to Protect Our Care, SEIU, and the entire coalition. And a particular gratitude to Congresswoman McClellan and Senator Ghazala Hashmi for their continued efforts in protecting rural Virginia. Once again, my name is Victor McKenzie, and I want to be crystal clear. This bill would rip more than $1 trillion out of Medicaid and the ACA yanking health coverage for an estimated 262 Virginians overnight. We know in rural Virginia, Medicaid isn't a program, it's a lifeline. It covers 1 in 4 adults, nearly half of all births, and 1/5 of every hospital stay. If you cut that lifeline, you cut rural care itself. The warning lights are already flashing. 6 of our rural hospitals from Lee County to the Northern Neck are at risk of closure. When a hospital goes under, just as the doctor said, detox beds and behavioral health units disappear first, forcing people in crisis to drive hours for help if they even survive the trip. Right now, more than 36,000 Virginians rely on Medicaid for medication-assisted treatment. And expansion allowed an additional 46,000 people to receive addiction care back in 2019 alone. Slashing Medicaid would pull that progress out from under us, just as overdose rates are starting to calm. And still, slashing Medicaid will be devastating not only for the entirety of Virginia, but particularly those who are seeking recovery in rural Virginia. And right now, those overdoses claim still about 1,500 Virginians each year. All told, these cuts could erect 3 critical barriers to recovery. The distance, because long winding drives replace local emergency rooms, workforce, because counselors and clinicians leave when hospitals shrink, and cost, because treatment becomes unaffordable the moment coverage is cost. And as the Congresswoman said, when that coverage is cost, people still need coverage. They still need services, and we see that the rest of us is taking on that cost. Rural communities matter. Folks in Wise County, Emporia, and the Eastern Shore deserve the same shot at recovery as anyone in Richmond or in Fairfax. And we should not be tearing down barriers. We should be ensuring that no new ones pop up. So I'm asking Congress, those at our state leadership, and all of our advocates and champions to continue the work of ringing the alarm and doing the work necessary to protect those in rural Virginia. Thank you so much.
Thank you so much, Victor, and thank you for your, not just your advocacy, but your longtime partnership with Protect Our Care. And next, I'm honored to introduce my friend and colleague Ryan O'Toole, who is the co-executive director of Freedom Virginia. Ryan.
Thank you, Katie. Good morning. I'm Ryan O'Toole, co-executive director of Freedom Virginia, an organization dedicated to creating a fair and affordable economy where hardworking people can get ahead. We're here today because President Trump signed the budget bill passed entirely by congressional Republicans that will endanger Virginians' financial well-being and result in costs going up for hardworking rural Virginians, especially when it comes to their health care. But let's talk about why this is happening. It's no secret that the top priority of the Republican budget was to give massive tax breaks to billionaires. These breaks were designed to benefit the ultra-wealthy, even giving them tax breaks to buy private jets, while simultaneously ripping health care from 17 million Americans. Not only are they cutting Medicaid, but they're taking away tax credits so that people can get affordable insurance on the Virginia marketplace, which is a good option for people, often in rural areas, who aren't able to get insurance through their employer. This bill is a slap in the face for so many Americans, passed only months after President Trump promised to lower the cost of living. This bill echoes what we hear from Virginians all the time, that corruption makes our government and economy work great for special interests, but not for regular people. The bill will have particularly disastrous effects on working Virginians and their families by slashing not just health care coverage, but also making grocery costs higher and increasing energy rates. Cutting services like Medicaid and taking away the enhanced premium tax credits from the ACA will have a ripple effect across the Commonwealth, especially in rural communities where health care is an economic driver. First, more than 300,000 Virginians will lose their health care. These cuts and burdensome restrictions will lead, second, to rural health care shortages and eventually hospital closures. Not only will this put the health and well-being of Virginians at greater risk, but it will also drive health care costs through the roof. According to a report from Third Way, these cuts would push 5.4 million Americans into a collective $50 billion of new medical debt. It's not a bug of the bill, but a feature that the bill will provide over $1 trillion in tax cuts for the richest 1%, paid for, not coincidentally, by nearly $1 trillion in cuts to affordable health care. The Republican budget proudly robs the middle class of their health care in order to pay for frivolous tax breaks for the wealthiest Americans. At Freedom Virginia, we know that accessible and affordable medicine and health coverage are intrinsically linked to economic prosperity. We're proud to stand here today and partner and advocate with partners like SEIU, Protect Our Care, the Committee to Protect Healthcare, Sarah of Virginia, and be alongside such determined legislators like Congresswoman McClellan and Senator Hashmi. While some of our elected officials, like Lieutenant Governor Winsome Earl-Sears, praise this devastating budget, we're especially grateful for their commitment to fight for Virginians. As we move forward, we must prioritize affordable care for everyday people to ensure they can keep more of what they earn and build a better life. Thank you.
Thank you so much, Ryan. Well said. And next, I have a friend, fearless advocate for workers and for healthcare from rural Virginia, Lachey Kelly Talafero. Lachey. I'll take your time.
Good morning, everyone, and thank you for having me today. My name is Lachey Kelly Talafero, and I'm a resident of Carrollton, Virginia, which is a rural community in Isle of Wight County. I am a grocery store worker and a proud member of UFCW Local 400. I am proud to be here today in support of my fellow union members in SEIU. I want to share today both how Medicaid has helped my family and what it's like to try to get to a hospital when you live in a rural community. I grew up in Smithfield, Virginia, but I went to school in Surrey, Virginia because my mother was a teacher. Now, Surrey is an extremely rural area, and I can remember playing basketball and one of my teammates got hurt. It was actually a pretty severe injury, and they had to bring in Nightingale, which is a helicopter, to get them to a hospital. Because even getting from Surrey to Smithfield is 30 minutes by itself. And you're not even at the hospital yet. You would still have to get across the James River Bridge to Newport News. So sometimes they would just send the Nightingale for cases as that. Now, Smithfield is a town, but there are parts that are more rural too, where it's harder to get to a hospital. We're talking no stoplights, no stop signs. All you see is cattle and a lot of farmland crops. I can remember when my dad had cancer and was trying to get to a hospital. A street was closed, and the ambulance had to turn around. It added 20 more minutes, so even in an ambulance, it took 40 minutes to get to the hospital, just going all the way around the bridge and all of that. I still have friends and family in Surrey who have to travel half an hour to see a doctor, but thankfully the Medicaid taxi takes them. And I just really hope that the cuts don't impact their service, because otherwise they would have no way of getting to the doctor. The Medicaid taxi also really helped my late husband, who had congestive heart failure that required him to get a heart transplant. He had to stop working due to his medical condition, so I was the sole breadwinner. That Medicaid taxi that took him to the doctor meant that I did not have to take off from work because we still had bills to pay and 3 children to support. It was so hard for my husband to get approved for Medicaid, it took a year. And I just can't believe Republicans in Congress are adding even more barriers to people getting health care. These requirements are designed to throw people off their health care, including people in rural communities like my family members. And it is so disappointing to see our governor and lieutenant governor singing this big ugly bill praises. Thank you.
Thank you so much, Lachey, for sharing your story. And next I have another healthcare provider, Dr. Henry Rizicki. Doctor.
Thank you, Kitty. It's an honor to be here, particularly amongst these fantastic women, inspiring. So I'm a pediatrician, and I was a neonatologist. I took intensive care of newborn babies. And as such, I knew how integral Medicaid is to the care of the people that I take care of. A third of all pregnancies are covered by Medicare. 50% of young children are covered by, Medicaid. And I know what happened. It was remarkable what happened to the care after we got Medicaid expansion. We would have babies in the intensive care unit who couldn't go anywhere. They'd have to sit for months because they couldn't get home services. And by the way, not having to do with kids, but on a personal note, I have my mother-in-law, and my father-in-law had dementia, went into nursing home care, and we haven't even talked about what's going to happen in nursing homes with Medicaid cuts. It's going to be horrific. All right, rural areas will be hit hard. All right, we would have. I've seen the effect of the decrease in obstetrical services in rural communities, and so you're talking about somebody with a high-risk pregnancy who needs to come and see a doctor every 2 weeks, and they have to drive 1 or 2 hours each way, and and spend a couple hours, so they have to take the day off. All right, and now you want to add an 80-hour a month work on that for people who can't do it. My colleague used the term misperception. I would use the term misdirection. Okay, the Republican justification for this was to say, oh, you've got this little spot on your lung. I think it's a tumor. Let's take the lung out. We have processes in place to look for fraud and abuse. All right, there's a great system that called the Medicaid Fraud Control Unit, and they recovered $1.4 billion last year. They recovered $1.7 million from HCA Columbia back in 1997 when Senator Rick Scott was in charge. If Medicaid reimbursement drops, hospitals are going to shut down, or more likely, in many of them, they're going to cut their services. So the example we had with the drop in obstetrical care is going to extend to other services. You're going to have the situation, as we talked about here, where if you're in a car accident in a place where there is no emergency room or no intensive care, you're going to have to get a helicopter, and there aren't that many of them around. All right? And if it's a multiple car accident, they're going to have to triage who goes first. and then you hope you get to the place that has the services. Just make sure that I hit all right. There's, for what I do, which is NICUs, there's going to be closing of that. Winchester's at risk, and there are probably going to be others, which means that babies are going to get transferred. Mothers are going to still be at the hospital where they delivered, if they have obstetrical services there. They're going to have to drive hours or get an Airbnb to go take care of their children. They're going to not be able to work. ER is going to have long wait times. So your child has, most of us, I hope, have seen The Pit, which is an amazing real-life description of what happens in an emergency room. A little bit dramatized, but overall pretty real. So you're sitting out there with your sick child, waiting to get seen for 8 hours because they've had to cut back. They haven't got the money to pay for the personnel. These are real things. And we've been told all sorts of things that I said are misdirection, to go focus. It's what magicians do. Oh, go look at here because you don't understand or pickpockets. That's an even better example, all right? They poke you on the shoulder while they're taking your wallet and then giving the wallet to Jeff Bezos and Elon Musk. I want to finish with one thing. In prep for talking about some of this, I happened to see a map of the proportion in counties of the population under Medicaid. And it's in rural areas, it's in Republican areas, and it's in areas that don't have a lot of health care. And I don't understand just the logic of the Republicans in office, in Congress who push this through, in our state leadership that's calling this wonderful, to say that vulnerable population is the one that we need to steal money from. I'm again honored to lend my voice to fighting this and appreciate the opportunity. Thank you.
Well, thank you so much, Doctor. Thank you to all our speakers, Congresswoman McClellan, Senator Hashmi. I want to go ahead and open it up to any questions from press. Dave Russ.
I do have to ask, I was a little bit confused. I think Congresswoman McClellan talked about the states not being able to do much. I think Senator Hashmi said there were some things that might be done. I'm curious if we're talking about congressional stuff that could be done with appropriations, stuff that the state legislature, the state executive branch could do. Where do we stand now that the bill is law?
So let me set the table on that. I'll defer to Senator Hashmi to talk a little more specifically about what the state needs to do. But this bill is going to lead to gaping holes in state budgets because of the cuts to Medicaid, because of the requirement for states to stand up the infrastructure for the work requirements. Virginia looked at doing it and didn't do it because it wasn't worth the cost. And Georgia has found it costs more to do that administrative burden on the state than they paid for care. Now the state's going to have to pay for part of SNAP benefits. And this is not done in a vacuum. So you've got all of this congressionally appropriated money that the president is already refusing to send. Just ask our schools, ask some of our hospitals that are still waiting for NIH grants. You have a federal workforce that is being decimated, and Virginia has the second highest number of federal employees of any, of all the states in the country. You've got a Department of Education that they're trying to close down and shift responsibility for special education to the states, which our localities say they can't pay. So when you look at the totality, there's not enough money currently, even in a rainy day fund or a set-aside fund in Virginia, to fill all of these holes. That puts Virginia in a position, they're going to do what they can, but they're either going to have to raise taxes or they're going to have to start looking at cutting services that Virginians rely on and expect. So it's not just the Medicaid cuts that are a problem, it's the totality, and I haven't even talked about the tariffs and the impact the tariffs have had. I haven't talked about the reversing the tax breaks for clean energy and the job killer that's going to be. You look at the totality of what this administration has done, it is a giant sucking sound for state and local government budgets that they've got to figure out how to fill.
Thank you, Congresswoman. I think she's explained the multiple and compounding issues that we're facing at the state level. And let's be clear: Donald Trump was handed a fairly robust budget, but a robust economy. We were on a good track, and we had the opportunity to continue to build and to make sure that we are restoring our infrastructure, improving our healthcare systems, working hard to improve education. Within the matter of 6 months, the Trump administration has taken us on a catastrophic ride. We are on a cliff, and we are facing economic hardship. And the first people that are going to be hit the hardest are our most vulnerable. So yes, there's some things that the state can do, and as I'm sure you know, we have 2 select committees in the General Assembly that have been meeting in anticipation of this big ugly bill, knowing that we were going to see some crisis points emerge. We were hoping against hope that our congressional Republican leadership would understand their fundamental responsibility to their own constituents, to their states, and do the right thing by rejecting the Donald Trump proposals, and that has not happened. And so what these 2 select committees now face, both in the House of Delegates as well as in the Virginia Senate, is to make those hard decisions. And as our Congresswoman just shared, it's not just our health care, it's not just the immediacy of the rural hospitals, it is the totality of all of those areas that the state budget is responsible for. Education is facing a crisis. Our food assistance programs are facing a crisis. We haven't even talked about the cuts to housing assistance. This is the intersectionality of so many communities, and the level of hardship is going to hit our most impoverished first, but it's going to have a massive ripple effect all throughout our entire system. And we haven't even talked about the fact CNBC just released its report and downgraded Virginia. Virginia has historically been first or second for the past several years as the best place for business. We are now 4th, and CNBC cited the massive layoffs to our federal workforce. Massive layoffs that I might say that our governor and our lieutenant governor have touted as good and positive moves. This is not the kind of leadership that we need from our state leaders, our governor, lieutenant governor, attorney general. We need state leaders who are going to be fighting for Virginians, and we don't have that right now, sadly.
Thank you. Anybody else have a question? I think we're just gonna hope for did you want to say something?
I just have a statement.
Sure, okay.
I'm Tony Heslop. I'm SEIU Virginia 512 home care professional. First of all, I want to take to the doctors on the panel. Good observation. I appreciate what y'all said. We, the healthcare professionals, we have a code of ethics, which is the strongest of a lot of professions. And because we're not just going to stop doing what we're doing. We actually care about people. We didn't go to school to get our certificates and licensing just to have them. We actually do care about people. And as politicians, y'all take an oath. And these Republicans need to be arrested because they're not honoring their oath. They're actually criminals. 83, that's the number of the richest people in America. 83 against the rest of us. What is wrong with this? What's wrong with this picture? They are now welfare recipients. They're getting more off of our backs. This is not right. And I'm just like both of you. I'm glad to have you both the champions. I'm not going to stop fighting. I can't wait for November to come around.
Thank you so much, Tony. And I know you're a home care provider too, and so thank you for the care that you're providing to veterans. I know. So with that, I think we'll go ahead and close. But if any speakers are able to stay and press have questions and want to chat, I'd certainly would welcome that. Thank you, everyone. Thank you. Oh yeah, let's do a group picture. Oh, sorry, we'll do a group picture real fast. I'll see y'all in the front.